Subscribe to our YouTube channel and press the bell icon to never miss a video from Radio 1.
Hey, this is Abhi with Sharma G right here, right now. What's happening in the world today? What's happening in India today? And right here, right now, I have to inform you that I too have been struck by the C virus. Oh yes, sirree, from being A positive person to B positive blood type to a virus C positive. But the person responsible in helping soften its impact, also to tell us more about how to deal with this third super spreader variant Omicron, or Omicron as they call it, is my very dear friend and Dr. Extraordinaire, Dr. V, or as Google searched by everybody, Dr. Vishakha Shivdasani. Put your hands together. Ding, 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 ding. Welcome, Dr. V. Well, where are you? Can we see you now? Woohoo! Please appear.
Thank you, Sharma G. Thank you for that lovely introduction, as always.
I'm adding a title to myself. I'm calling myself the Covidian Sharma G now, since currently.
Dr. V.
Yeah, I know. No. I hope there are not so many variants till the V, but I can tell you that, holding fort out there and making sure that from A to Z, everyone is cured, everyone sees the light at the end of the tunnel is Dr. V, is Dr. Vishakha Shivdasani. Really tell me, Vishakha, how has it been for the medical fraternity? I mean, it must be going crazy. These must be the craziest times that people are seeing, because I know the amount of testing, the amount of patients who are coming down with Omicron. It must be truly a crazy phase right now.
Crazy phase now. Delta was terrible and we thought it was behind us, but hey, it's a virus. And like you said, it mutates. So it struck us by surprise again. And we hope in terms of severity, this is not going to be like Delta. It doesn't look like it, but the sheer volumes and the infection rate, absolutely overwhelming for the entire fraternity. And people are also worried, they're scared, also because of what they've gone through with Delta. So many reinfections, family members affected, so they're scared. I think it's more fear psychosis, really. So, we have to, while we treat them, we also have to calm them down to say that this does not look like a Delta variant. It does not look as virulent. So it's not going to convert to really being a disease. It's just very infectious and you have to do what it takes to protect yourself and your loved ones.
So is it like one step above an infectious cold?
See, in terms of symptoms, I would say pretty much. So it's like getting a bad viral. And you're out before you know it. So it's not like the Delta where you're sick for 14 days, very few and far between. Typically day 4, day 5, you're okay, which is what we saw with, with what we see with a regular flu or a viral fever. You're typically down for 3, 4, 5 days and then you're okay. I think the problem with Omicron is that we don't know the long-term side effects. So we don't know how they play, because we don't have time. That only time will tell. So we don't know if it's going to be like long COVID, but prima facie, I would tell all my patients, and I would love to tell your viewers, that it doesn't look like a virus that you need to be worried about. It's more often than not, we just give symptomatic treatment, rest it out, and we can come to the details, but it's not looking bad. So don't, that fear-mongerism gets to people more than anything else, really.
So, Dr. V, I first, before moving on, I want to congratulate you on the book that you wrote last year. And I remember interviewing you for that book, and you were on the night shift, COVID and post-COVID recovery, Dr. V's 6-point plan. Congratulations. I know millions have read this book, not only in India, but worldwide. That's her copy. My copy, autographed by Dr. V, is lying there. And I've been reading it again. Because of course I'm now struck by COVID myself. But tell me, Dr. V, did you ever think when you wrote this book that this would still be on as we speak, or we would have seen the end of it around, I don't know, halfway through past the last year?
No, I certainly didn't foresee this, in all honesty. I thought, it would pan out and it would peter out in a matter of months. because this is a one-of-a-kind pandemic, at least in my lifetime, right? I haven't gone through the Spanish flu, etc. But in my lifetime, this is, for most of us. And no, I did not foresee this happening at all. But when I wrote the book, I have to say though, I did have in mind that the book would last longer than the pandemic, because the book also talks on how to focus on just building your immunity. And more importantly, it talks on how to reverse disease. Yeah. And we know that in COVID, it's the people with the comorbidities who have the worst outcomes. And the book talks about that. So it goes far beyond the pandemic. I think it's a relevant book. It might have the name of COVID, but it would be relevant for anybody who's trying to reverse their diabetes or obesity or PCOS or any of the comorbidities that we know have the worst outcomes with COVID.
True. Okay, I'm going to move straight into the questions now. A lot of people have written in. A lot of people want answers. I've come up with some thoughts myself. So here goes. One is, how contagious is this variant?
Exceptionally. If we are comparing it with Alpha or Delta or any of the previous variants, I mean, the doubling time is 2 or 3 days, which is why we see the numbers growing so exponentially. What it basically means, to simplify it, you need about 10 seconds of exposure to somebody who's had, without a mask, with somebody who has Omicron. I'm talking Omicron specifically. Now, 10 seconds of exposure is nothing. You could be in an elevator, 1 floor, and you could be, some studies say 5 seconds, some say 10, but the point is that it's hugely infectious. So you don't have a choice but to take care and to maintain COVID-appropriate behavior.
Okay. Tell me 3 must-dos for COVID patients, for patients who are suffering from any variant of COVID, or specifically Omicron, because that's what's virulent right now.
Yeah, so about 80 to 90% of the patients we are seeing have Omicron, and we can say this just based on the symptoms without testing. But because it is a community transmissible transmission right now, so we know it's Omicron with the doubling time. First thing you need to do at the onset of any symptom, if you've randomly got a fever, throat pain, a lot of body ache, myalgias, running nose, sniffles, first thing you do is isolate. Just isolate yourself immediately. Look, testing can happen after a day, after 2, because the labs are inundated with work. Even if you manage to get somebody to do your test day 1, day 2, you may not show up to being positive day 1, day 2. And even if you are, the lab might give you a report after 48 hours. So you need to, irrespective of when you test and when you get the report, until that happens, just isolate. Because like we have said, because it's as infectious, you're going to spread it to the entire house in no time. So isolate. If you're lucky and it's negative, so be it. You've spent 2 days in isolation. But that is non-negotiable, and I cannot emphasize on it enough. First thing, just stay apart, especially if you have older people at home. If you're living with your parents, in-laws, people with comorbidities, just because we don't want them to have ill effects of this virus. So that's the number 1 and the most important thing that you need to do. And secondly, of course, you speak to your doctor. Let your doctor decide based on your symptoms whether you need to test or whether you don't need to test. See, we cannot forget that there is malaria and dengue and normal viral and all of that, right? So everybody who has a fever to test. So we can kind of gauge based on your symptoms, not with accuracy, but more or less. So speak to your doc. Let your doc decide based on your symptoms what you need to test. If you need to test for other, infectious diseases also, when to test, that is very important. Don't self-medicate, don't self-test and examine. And once you have gotten COVID, of course, you need to follow, the 6-point plan that I've written in my book. You need to take care of the kind of food you eat. You need to take care of the supplements you have. Your sleep is hugely important because it helps you recover quickly. People forget about gut health, but 90% of our immune cells is in our gut. So you need to take care of your gut health. You need to not stress. So when you stress, you go into this parasympathetic nervous system overload, and that can create a cascade of ill effects with the hormones. So in my book, I have spoken about the importance of breathing correctly, meditating, just so that you calm yourself, just so that there's not enough anxiety, that you can sleep. And for patients who cannot sleep, I've also included certain supplements. You can take melatonin, you can take magnesium. Don't jump to taking your, sleeping pills, which can actually reduce your immunity. So do all those things to make sure you expedite your recovery. And again, remember that this is not a very virulent virus. You will recover. So just follow a plan to make sure you not only expedite your recovery, but hopefully you don't have any complications. That should be the aim.
Okay, 3 must avoids for COVID patients.
For Christ's sake, don't self-medicate. The number of people who call me up day 3, day 4. See, with this Omicron specifically, we're seeing a lot of patients who get sore throat. Right? And when you have that sore throat and even slight mild pain in the throat, the first thing that they do is jump to take an antibiotic, especially drugs like azithromycin. Remember, Omicron is a viral infection. We give antibiotics to take care of a bacterial infection. Taking an antibiotic the first few days of a viral infection will do you more harm than good. So many patients call up and say, but we are day 2 of an antibiotic. No, but we had a bad throat and we took it. This is not tonsillitis or pharyngitis. Please do not take it. Yes, there is a certain group of people who need antibiotics going forward to prevent a superadded bacterial infection. Let your doctor decide that. Don't be your own doctor. You'll do yourself more harm than good. Steroids and Omicron is out of the question. Until you're in hospital, your oxygen saturation is dropping, which we are not seeing with Omicron. Let your doc decide. Please do not take wrong medication. I cannot emphasize on this enough, because more than 50% of the patients I see have called me up after they've taken 2 doses of antibiotics. So you'll be doing yourself more harm than good. So please speak to your doc, let your doc decide. Don't play doctor. You just be playing a bad doctor.
Well, you're looking at my doctor. Yeah, I mean, if I had my way, I would be calling her 24/7. Of course, to hear her healing words, but even to look at her. So yes, that's my doc, and like you said, you don't mess around with Dr. V. Okay, 3 must-dos for non-COVID patients. I know you've already given us a couple of pointers, but again, if you could spell it out, because then I would love to put it there as 1, 2, 3 for non-COVID patients right now.
If you've not vaccinated, please go take the vaccination. The most important thing. If you have taken your vaccination and if you are a candidate to take the booster, now that it's starting, for people over a certain age or from 15 to 18, please go and take the booster. That is the most important thing. That being said, remember, for people who've taken the vaccines or who will be taking the booster, it does not mean you should not maintain or you cannot maintain COVID appropriate behavior, and it's okay. It's not. We have seen patients over and over. I get calls every day from patients who've had COVID during Delta, who've taken the 2 shots and who've still gotten COVID because of breakthrough infections. A vaccine only prevents severity of disease. To prevent getting the disease, you have to maintain COVID appropriate behavior. You have to mask up. You have to sanitize. You have to make sure you don't go into crowded places. The 2 are independent of each other. So just remember these 2 things. Vaccinate and maintain COVID appropriate behavior. It's not do this or that. This is not negotiable. Both things.
So tell me, Dr. V, what can we do to build more immunity, especially with stuff that's coming into our stomachs?
Okay, so a couple of things. Let's remember first that you can't enhance immunity overnight. It doesn't happen. So when people say, drink this kadha, do that, have all these things, take these vitamin supplements for a reason. They supplement your lifestyle. That's not mainstay. Yeah, they help. They hugely help. As long as you're doing everything like a holistic lifestyle. Use this time. If you've got COVID, if you're a long hauler from the Delta, if you're trying to prevent from Omicron, or if you're just trying to be healthy, use this time, if you haven't already, these 2 years, and we don't know how much longer, courtesy Omicron or any other variant that may happen, to build your health. If you have any comorbidities, to reverse those, because most comorbidities can be reversed. So whether it is Omicron, whether it is Delta, whether it is any other variant, the only thing that you have in your control is your health. Make sure that you do what you can then to reverse this, because it can be done. Don't just focus on, oh my God, I'm so scared. What's going to happen to this variant? Is it going to get to me? Is it going to, if it does, if I do get affected by it, Am I going to succumb because I have, or land up with complications because I'm diabetic or because I'm obese? I mean, what are you doing for 2 years? What are you doing now? Why are you still obese? Why are you still diabetic? Type 2 diabetes is reversible. PCOS is reversible in more cases than not. That's what you need to do. You need to do what it takes to take control of your own health. Use this time judiciously for that.
Thank you. Thank you so much. And now the last question. We've all been talking about it being super contagious. Now, how do therefore all these family members in the home, can we be in the same room? Do we have to avoid it? Can we be in the same kitchen? Or do we avoid being with each other? Do we wear masks? How does it happen if there are more than one patient in the same house?
So first of all, Gaurav, you're asking me a first world question. Huh? So this is for people who live in slums and people who live in, poor people, they don't have the luxury to even ask this question or to, yeah. So for people like us who are blessed and we, can isolate and can, separate out. If two people have COVID already, or in this case, in Omicron, we're seeing when one person has, typically the whole house gets the virus because of its sheer infectivity. It's okay to be together. It's okay to even be without a mask. It doesn't matter what your viral load is, unless somebody has huge comorbidities and is immunocompromised. That person may be, but even then it's okay to go and see the person in the room. Other than that, it's absolutely okay to be with the people. All of you can be together. Look, during Delta, very often we used to have father and son who had COVID, and we'd say, go and share a hospital room. So the son would be on the guest bed and the father would be on the regular hospital bed, because those days they would be in hospital 10 days, 12 days. And they would actually, give each other company. There's a lot to be said about of the mind in COVID. I tell all my patients, I think, God forbid if I were to get COVID also, and I keep telling myself this, I think the one thing that gets most people down is the isolation. Yeah. So just being together in itself makes a big difference. And no, it's safe. It's absolutely safe to be together. So don't isolate, couples and brothers and siblings, and just be together. And before you know it, it'll be the end of the virus. And hopefully it will not take 14 days, in less than 7 days. And the new guideline says in 7 days, if you're asymptomatic the last 3 days, and if you don't have a fever, you can actually be out. You've got the green card. So it's 7 days now. So let's all be responsible.
Tell me, lastly, you've got such a successful book. Are you writing something else? Are you working on another book, whether it's to do with nutrition, whether it's to do with wellness, whether it's to do with COVID? Is there something that is up your sleeve?
My God, you're asking me this question that everyone seems to be asking me. Ironically, Gaurav, I was writing a book on immunity before I wrote this book. And it was about 80%. I was like 60,000 words down. It took me an entire year to write that. And right in the midst of it, COVID happened, and there was a change of focus. And that book, those 60,000 words are still there. And I'm sure if I published that book on immunity, it would be a bestseller in no time. But right now, as of today, if I get time to eat 3 square meals, I'll be happy. So the book can take a backseat, and it's interviews like yours that I'm happy to disseminate the information. So whatever goes into the books goes into all my interviews, whether it's television or radio or my Instagram. And I'm just happy that more and more people can benefit from the info. Don't need a book for it for now.
Thank you so much, Vishakha, Dr. Vishakha, Dr. V. I mean, I've got so many names, I get confused that what's the name I need to address her when I'm doing a media interview. But you need to tell me, how's this new look of mine? Yeah, I mean, do I look like a patient? Am I looking, I
think credit goes to your doctor.
Okay, Dr. V, I want to know, what is the lifestyle that people need to adapt to in order to now continue life, either post-COVID or even if they've not had COVID, but what is a lifestyle that all of us living in this new world need to live?
Sure. So whether you have COVID or whether you're just trying to be healthy or reverse comorbidities, the protocol stays more or less the same, which is basically eat good amount of protein, to build your antibodies, the antibodies that we talk about post-vaccine. We have to measure your antibodies. How many antibodies do we have? It kind of tells you how your body is responding and fighting an infection, whether it's a virus or a bacteria. Those antibodies are made up of protein. So if you don't eat enough protein in your diet, how are you making those antibodies? So if you're sick and trying to recover, or you're just trying to be healthy, make sure you're eating a good amount of good quality protein in your diet. Don't fear your fats. Make sure you're eating your good quality fats, but don't fear them. Knock off all the seed oils. No sunflower, safflower, rice bran. Just make sure it comes from a good old ghee, butter, or olive oil. Eat your nuts, seeds. Make sure you're having your good fat. And especially for people who have got COVID, who are fighting COVID, there is no room for refined sugars. Nothing cripples the immune system like sugar does. Okay. So if you want to just knock off the sugars. You're sitting in your room, isolated, watching Netflix and wanting to eat rubbish in the middle of the night. Please don't do that. Just reach out to a handful of nuts if you like, or reach out to whatever that's protein-based. No cakes, no pastries, no chips, nothing that comes out of a tin, can, bottle. Do yourself a favor. Yes, Sharma G, I can see you. Come on now. I hope you've been following my protocol. But absolutely no room for processed food and sugars, because you want to do everything that helps your immune system fight the virus, not stuff that cripples your immune system. So no processed food. As far as vitamins and supplements are concerned, everybody is already on multiple cocktails, but I'll tell you the ones that really work. Vitamin C, zinc, and vitamin D. Specifically vitamin D and zinc and C. These three are very, very important. I won't get into the dose and things like that, because that is individualized and you need to speak to your doctor for it. Then you have specific vitamins based on what your symptoms are. For people who are unable to sleep, or who've got their pulse rate going up really fast because they're really anxious, I really like the use of magnesium. It helps you sleep at night. It keeps you calm. If you're constipated, especially with the older lot of people, I hear it so much, because for them constipation takes over their life. Then it helps. Magnesium helps with that, right? Because you're not really moving. So how are you going to get a good bowel movement? Melatonin is another drug that is it's not a drug, it's a supplement that not only aids good quality sleep, but it also enhances immunity. So by all means, speak to your doc and take a melatonin tablet instead of taking a sleeping pill if you can't sleep. I'm just going to touch on these because these are basic vitamins. The other ones need to be, monitored by your doc, whether you've got lung symptoms or whether you've got any form of inflammation. Then we give specifics. But a cocktail of these vitamins are very good for you, and you can safely take it for 2 weeks or 3 weeks. They will help expedite recovery. They will help prevent viral replication. So good to take. Make sure you're hydrated really, really well. Make sure your gut is in good condition, like I said, because most of your immune cells are in your gut. And again, in my book, I've written of specifics what you can do for that. Meditate, because meditation will calm you down immediately. Yeah. There's called vagal breathing that really, really helps even reduce your pulse rate, and it does it in a few minutes. So you can Google that, check it on YouTube, and while you're in isolation, it's a good time to get started on these things, because it will actually, whether you have COVID or not, for whatever reason, if you're isolated, I think doing these things will actually be like your steps to a great health going forward. So, it just sets the template. So use this time.
Okay, there are these new drugs that have entered the market to combat COVID, something called the cocktail. Do you recommend this for patients?
Well, this is a cocktail which does not entail any alcohol. Okay, let's.
Damn.
It's monoclonal antibodies. Okay, so the thing is, this cocktail actually really helps people with the Delta. Not so much for people with Omicron. Now, we are left with only about 20% of people who've got the Delta. So for those patients, but we don't know for sure except with symptoms. By the time you really know, it's day 4, day 5, by which time it's too late to give the cocktail, because the cocktail needs to be given the first 3 days. Secondly, people who've got multiple comorbidities or who are really immunocompromised, they may still do well with the cocktail. For the rest of the population, I don't recommend it at all because, like I said, it's a mild virus. It seems like, from the way it's panning out, that you're going to recover soon in any case. So just rest it out, follow my 6-point plan, and before you know it, in 7 days, you'll be out. So there's no need for that. The newer drugs that you're talking about, again, I have so many patients who say, but doctor, it costs only 1,500 rupees. Can we take it? There's not too much study to say that even the new one works for Omicron. I don't want to take names, or actually, even if doesn't matter, it's molnupiravir, but there's not too much study to show that it works against the Omicron at all. So speak to your doctor. If your fever maybe is not breaking day 4, day 5, maybe he or she would recommend that you take it. Else, just let your body do its job. You don't need anything else. This is a virus that responds to symptomatic treatment and rest.
Thank you so much, Dr. V. Thank you so much, Dr. Vishakha Shivdasani. I keep saying both the names because, the world knows her. Some know her as Dr. Vishakha, some of them as Dr. V. But thank you so much. You've been an angel to, I said it on my radio show also, that you've really been an angel, not only to me, but to everyone who you touch. So thank you, and keep continuing all the fabulous work that you're doing.
Thank you. Thank you so much. And thank you for having your faith in me. Most important.
94.3 One World, your station. Radio 1.